Senator Bill Cassidy joins us. Senator Cassidy, how you doing?
Hi, I'm doing great, Moon Griffon. How are you, buddy?
I'm doing fine. Jump with you on something, and something that I didn't have written down, but I was reading. We never did really change Obamacare out. Now, I think you're coming up with a new way to change some stuff. Let's talk about that first. What are some new things that you're looking at dealing with Obamacare and making some changes in health care?
Yeah, so we did get rid of the individual mandate, a couple other things that, people hate about Obamacare, but clearly premiums are still going up. You know it as well as anybody, better than most. And that's not just for the individual market, but now it's the group market.
Sure.
When Trump says he wants to drain the swamp, there is a lot of swamp in healthcare that needs to be drained. Where everybody's making lots of money, but it is the patient and the person paying the premium that pays more and more. We can change that. We can make it so that the patient has the power of knowing the price of something. That begins to lower prices, saves you money, but also saves you on the premium, and that's our goal.
How do you get there, though?
So, easiest thing is price transparency. You go to buy jeans or a cell phone, you shop around, you figure out what you want, where you want to go, the quality, and boom, you go and buy it. Can't do that in healthcare. But you can't do it in LASIK surgery. If you want to get LASIK surgery for your eye, you see the billboard. It used to be $900 an eye. Now it's $300 an eye. The quality's better and it costs less. That's what happens when you have markets. So let's talk about drugs. Consumer Reports has an article. You can go to their website. They had secret shoppers go out and buy generic medicines. The price varied. Now, you don't know this, but the price varied between $44 and $700, the cash price for the same medicine. Now, you walk in, you got a deductible of $5,000. You know you're going to pay it. You just assume it's $700. You don't know. That's wrong. You should be able to scan a barcode. Tells you, $44 here, $700 there. Guess where I'm going?
Yeah, no doubt about it. Actually, I had that. I think I explained that to you, that when Obamacare kicked in, not this past January, but January before, last year, my first payment of medicine for my daughter was $2,800, and it was going to be $2,800 a month. A month. And because we were able to make some adjustments, we got it down to about $1,100 a month. That's on top of the premium, by the way.
Now, by the way, what you don't know is if you'd gone to a different pharmacy, would it have been far less? Again, I think that Consumer Report article, they had 5 medicines they looked at. If you took all 5 together, in one pharmacy, it was like Costco online or an independent pharmacy, it was like $380. And in another pharmacy, which is a big chain pharmacy, it was $1,300. You wouldn't know unless you had the ability to call around and get the cash price. Moon, you might have been able to get a cash price, just didn't know it. A better price.
Well, no, we didn't know it. As a matter of fact, it was a humbling experience to cut a check for $2,800. When you're trying to figure out where you just come up with $2,800. Well, by the grace of God, I had it to spend it, but I didn't have it every month. You can book it, and we were able to. I forgot what we did to get that down to a measly $1,100 a month on top of the massive $2,600 premium that I was paying that year. So
let me tell you something else we want to do. Just staying on drugs for a minute. The insurance company will sometimes negotiate a better price for a medicine. So say the medicine costs $1,000, but the insurance company gets it down to $500. Well, that's the price the insurance company gets once the insurance company begins to pay. But for lots of folks, they would still pay $1,000, and the insurance company claws back the $500 they overpaid, so to speak, from the pharmacy. You don't get the same price as the insurance company, not always. Rather, you get the price that is the list price. Not the pharmaceutical company getting the money.
Yeah, but Senator Cassidy, think about what we're doing right here. And by the way, it's just not a cut on you. I'm just saying, if you got to go through rocket science to figure out how to just go get medicines, you're screwed. Think about it. Just think how bad Obamacare is if you have to do all that just to figure out how to pay for medicine. And in our case, I got a special needs child who takes medicine for seizures. You know, I've tried everything. People say, did you try this natural stuff? We did all that. And so it's just ridiculous that someone has to even think about going through all that just to buy medicine for your child.
And we're trying to make it easy.
Yep.
In the legislation we have it on our website, making health care affordable again.
Mm-hmm.
And so it's on our website, cassidy.senate.gov. And we're trying to make it easy for the patient to know how much something costs, not what they're going to necessarily be charged at one particular place.
All right. One of the things President Trump's plan to lower drug and health care prices, is it along the lines of what you're talking about doing, or is it something else?
Totally. A lot of the stuff directly overlaps, and Trump can do it like in Medicare, but we also need to do it in the private insurance market. And so I've already met with President Trump's administration on 2 or 3 occasions. We're working hand in glove to try and make it work for everybody.
What? Can I get your take on something real quick? You know, we're the biggest Medicaid state in the country. I mean, we pay out the bigger benefits. Do you think it was a good idea to go in that direction? Because financially, we you know, I don't know if you know this or not, but our GDP in this state has gone down 2 years since we accepted Medicaid. And we don't have money for nothing else now. And the growth has been unbelievable. I just wanted to get your take on where you stand and what should be done, because if the federal government ever says, you know, we're not going to pay 97, 98% anymore, we're going to pay 70%, we're going to have big problems here.
We got to have a people got to have access to health insurance and health care, but you got to have a sustainable system. By 2020, by my calculation, the state's 10%, so at that point it'll be 90% federal and 10% state. The state's 10% will be $310 million. I don't think we can afford $310 million.
Yeah.
And everything else is getting cannibalized. Funding for LSU, ULL, the other state colleges.
Yeah, that's what I meant.
Getting cannibalized. And now they say, wait a second, no, we're just taxing the hospitals. Well, there's no free lunch.
No.
You're paying more for something.
Correct.
And it's not sustainable on the federal level, and it's not sustainable on the state level. So we got to do something different.
You know, Senator Cassidy, we're speaking to Senator Bill Cassidy, our United States Senator. One of the things that's been a concern with the Medicaid expansion is about 20% of the people dropped their regular insurance and went to Medicaid because of the policies are so liberal that they were able to do that, so they don't have to pay anything anymore. And they're getting health care, and that brings a drain off the people that could use it. You and me would both agree we want something for poor people that we can help them with some medical stuff. But we got people perfectly capable, and we got a group of people perfectly capable of going to work. They won't go to work, and they're getting Medicaid. Those are the ones that we're frustrated with if you're conservative, not from helping people that need it. It's all the people that are getting it that shouldn't be on it.
So that's across the nation. If you look, the Government Accounting Office did an analysis of California, significantly more enrollment in Medicaid than would really be eligible. So taxpayers are paying for that, and as opposed to the individual. And it's something that's going to be very difficult to afford going forward. And you can just look at the cost of the debt and deficit. I'm all about the debt and deficit. The debt and deficit is being driven by healthcare spending. We got to lower the healthcare cost, but we also have to make our spending more targeted and effective and appropriate, such as you just said, or else we're just going to go bankrupt.
Yeah, and that's
what nobody gets healthcare.
Yeah, that's what worries me. It's eating up every penny we got. We got the governor down here who never met a tax he didn't love to accept. And that's just not a way to run a state. And by the way, our GDP is negative for 2 years, the only one in the country. I mean, if your economy's going down, you can't keep expanding the government. And yet in Baton Rouge, we continue to do that, and it's very frustrating. All right, the Mexican drug cartel, you made the comment, get them to pay for the border wall. How do you do this, and how do you think that can happen?
Yeah, so the cartels that move about $110 billion, that's billion dollars a year from selling illegal drugs to Mexico. Now, right now, we confiscate less than 5% of that. If you're able to confiscate more, you put a crimp in their ability to finance the drug trade. That's a good thing. They can't move fentanyl across the border if they can't finance it, so let's take care of the financing. The other good thing about going after that money is that you could use it to secure our southern border. It wouldn't be the Mexican government, it'd be the Mexican cartels paying to secure our southern border, and that's probably a better thing. So right now we get about $7 billion of that $110 billion. What I'd like to do is increase that amount. We're working on understanding how it's moved, and once you understand it, you go after it, and then you use that money so collected to again secure our southern border.
Yeah. So anyway, let me take a quick break. Senator Bill Cassidy will come back with one quick segment right after this. 844-766-6607. Hickson has a hotline. We'll take a break. Be right back. You're listening to the Moon Griffon Show. Hi, hello. Welcome back. Moon Griffon Show. Great to have you with us. 844-766-6607. Hickson has a hotline. If you'd like to be part of the program, Senator Bill Cassidy joins us. Bill, I got a question. I think it's dealing with health care. Let me just throw it out there and let him ask. Walton Shreveport, question or comment for Mr. Cassidy?
I have just a statement. I turned the radio on and heard you guys talking about the cost of medication. I'm a Vietnam veteran. I
Thanks for your service.
Chronic lymphoma leukemia. The VA approved me going to MD Anderson. This was back a couple of years ago. And when it came time for me to start taking the medication and I came back to the VA, they refused to pay for my medication. I was paying for months.
Walter, I think you got your radio on, Walter.
Cents a month. And it was not until just doing the presidential campaign that a nurse at the VA hospital contacted some of now President Trump's staff, campaign people, and they contacted me. And after that, they asked me to do a political ad about how the VA was treating me. I did an ad. It was never played to my knowledge on the radio or TV. And it was after that the director of the VA hospital from Washington called me and asked me to meet me at the VA hospital in Shreveport on the following Monday morning. I met him, and that's when the changes. He told the oncologist there to allow me to come in once a month, have blood work done, and for them to issue me my medicine. And that's when it started.
Walter, real quick, though, because of time, do you have a question for him at all, real quick?
No. What are you doing about the plight of the veterans?
Okay.
As far as the cost of medication.
Okay, great question. Walter, first of all, thanks for your service. God bless. Let me go ahead, Senator Cassidy.
Hey, Walter, again, I thank you for your service as well. Listen, one thing we just passed this past week is the Veterans Choice Program, and that allows veterans, if they need care such as you receive, to go to the place where they can receive it. There's a lot of folks who, for example, in Lafayette, were finding they were having to go to Alexandria to get an eye exam when they've got all these optometrists in Lafayette and ophthalmologists that would see them for their eye problems. And so we just reauthorized the Veterans Choice Program again last week. We're doing other things as well. Hepatitis C, big issue among veterans. I was the leader in making that medicine both affordable and available for veterans to receive the hepatitis C drug, even if they weren't going to the VA. If they lived too far from a VA, they could go to their own doctor and get it done there. As a result, lots of veterans have been treated for hepatitis C. We've done other things, but those are two good examples.
Yeah, okay. Senator Bill Cassidy, once again, we appreciate your service. By the way, I saw you, and I want to say our other junior senator request for the Senate to stay in session on weekends and stuff. What is this about? What is the drive from this?
Yeah, Democrats led by Chuck Schumer have been President Trump's appointees, and so demanding 30 hours of debate, in which we didn't debate anybody, or we debated everything but the nominee, and then the nominee would pass 96-2. Yeah. For example, Terry Doty is the new judge in Monroe. They demanded that we discuss them for 30 hours. Turns out you don't discuss legislation. You theoretically are discussing Judge Doty. We didn't discuss them, but we didn't get on any legislation. So that delays everything. At this rate, Trump will finish making his appointees 9 years from now.
And by the way, Obama got his really quick.
Real quick. So what we've just said is if they want to obstruct, okay, let's stay in over August. I'd rather be back in the States seeing folks. I'd rather be learning things. But if we need to get President Trump's appointees in office, keep us over August. What I suspect is that Schumer will say, oh, my gosh, I don't know what we're doing after all. You can have 2,000 appointees right off the bat. If that's the case, that's fine. But if not, let's stay in.
Yeah, but what is the chance of them staying?
Oh, I think McConnell wants to make it happen. He recognizes that we've got to get things done. And obviously 16 of us sent him a letter saying this is what we should do. But we got to get it done, and McConnell knows that.
Yeah, well, I hope they get it done. I think it's a shame they've hesitated on Trump and on these nominees. Like I said, with Obama, it was bring one up and vote on them, bring one up and vote on them. It was never like that. But of course, people on that side of the aisle will never ever agree. People that they liked Obama, they didn't give a dang what he thought, what he did. So it's kind of frustrating.
The left hates Trump so much that do whatever they can to slow down what he's going to do, even when it's good. And so we just got to push on, recognizing they're not going to cooperate. For example, we had legislation that Democrats helped write that would have lowered premiums by as much as 40%, health insurance premiums, going back to that. And that's part of my proposal as well. Democrats voted against it for partisan purposes. Interested in the solutions. We got to lower the costs. We got to do a good thing, get Trump's appointees in. If we stay in late, we stay in late.
All right, Senator Bill Cassidy, appreciate the call. Good luck to you.
Thank you, Moon. To you too, buddy.
All right.